Hey, what's going on, guys? It's Joe from Gen Z Investments, and today I'm going to be talking about Regeneron stock. Regeneron is the most profitable and well-established company in the growing healthcare industry. The industry is growing in terms of total addressable market, technologically, and market capitalization, and Regeneron is positioned perfectly to take advantage of that. So the most important thing that you have to take into consideration and research when looking into any healthcare company is how sequencing costs have come down exponentially over the last couple of decades. It used to cost tens of millions of dollars to get a human genome sequence, but now we can do it for under $1,000, and even Illumina is saying that their next-gen sequencers are going to be able to do it for $100 to $200. This means that insurance companies will have hard to diagnose cases be sequenced. So, in other words, say I go to the doctor and there's something clearly wrong with me, but the doctor is having a hard time specifically diagnosing what is wrong with me. The insurance company will then pay for you to get your genome sequenced in order for you to get the correct medicine, in order to really see what's wrong. So that alone is life-changing, game-changing for the industry and for people's lives. So just think about how much time and pain that can go away by just getting your genome sequenced, because you find out what's wrong right away, and you see what genetic mutations are causing it, and you can treat the underlying disease or mutation instead of how medicine works today, where they don't actually treat the underlying cause. They pretty much just stop it, which allows for more relapses. So what this whole human genome sequencing cost decline is really bringing about is precision medicine. Precision medicine is going to transform the healthcare industry as a whole, because now, instead of a one-size-fits-all approach of medicine where millions of people get the same exact pill, the same exact therapy, whatever, once you get your genome sequenced, there can be a therapy designed or a drug designed specifically based on the data of your genome. So it's specialized, personalized, more effective. It takes into consideration your environment, your lifestyle, your genes, right? And so with these lower costs and this higher technology and this greater technology in sequencing and higher accuracy and efficiency and portability, everyone's going to get their human genome sequence, and everyone is going to try to make drugs or therapies in order to stop what is wrong with their genome. So this industry is going to explode. People are going to be able to live longer. Things like cancer, blindness are all going to be cured, right? The amount of money that's being poured into these cancer therapeutics and liquid biopsies and oncology and all the data that we've collected, it's just a matter of time. And just wait until artificial intelligence gets involved. Artificial intelligence is why we were able to develop a vaccine for COVID so fast. So once artificial intelligence gets into the mix of this, drugs are going to be coming out like clockwork, and people are going to live longer, healthier, better lives because of it. So pretty much all of these trends that we're talking about, Regeneron is positioned perfectly to take advantage of it. As I'll get into later when we talk about the financials and the valuation, this is the most profitable company in the industry, not close, and they're a cash cow. They bring in cold, hard fucking cash, this company. But let's talk about how they make that money. Dupixent and Eylea. I'm not sure about the pronunciation, so don't get pissed at me. But Eylea, whatever, is a VEGF, which is a vascular endothelial growth factor inhibitor. So what this really does is that it stops the body's VEGF protein from forming abnormal blood vessels in the eyeball. And a body with an overactive VEGF protein can form way too many blood cells in the eye, and then those abnormal vessels can leak, causing vision loss, blindness, discomfort, pain. So this drug ended up being in extremely high demand, and they are bringing in cash. Just in the last quarter alone, they brought in net sales of $904 million off this drug, which is 40% year-over-year growth. So if you're making close to $1 billion in net profit off of one drug, that shows just how much money this company is really making. And the next thing is Dupixent, which is going to end up being bigger than Eylea, which has brought in billions and billions of dollars of sales. But this drug has potential to be bigger than Eylea and actually the biggest drug on the market. Dupixent is transforming the treatment of type 2 inflammatory diseases. It has a bunch of regulatory approvals at atopic dermatitis, which is like, you get all itchy, kind of like eczema, kind of not, but you get really itchy in certain areas. I know I get really itchy on my neck sometimes, but like really irritated, itchy, dry skin, right? So that can be a real fucking pain in the ass. And this drug cures it. Also, asthma, chronic rhinosinusitis. I don't know how to fucking say these things. I'm not a fucking doctor, but that sounds pretty important. And what that is with nasal polyposis. So it has something to do with your nasal nose. Not sure the exact science behind it all, but that's just another thing that has already been approved for. And this is the crazy thing. This drug brings in billions and billions of dollars, right? Like in the most recent quarter, they brought in $328 million in net profit, which is 101% year-over-year growth, and $1.4 billion in revenue, represented year-over-year growth of 73%. So this is a huge drug already, and this is the crazy thing. Only 6% of its use case has been approved. So this drug can grow exponentially from here, right? And according to Bloomberg, they're saying $5.7 billion in 5 years to overtake Eylea as Regeneron's top drug. And it's just crazy because they've sold $4 billion worldwide, and doctors have only treated 6% of eligible patients. So it really is crazy. The market here, it can really be expanded. So again, these are the two drugs in which Regeneron, his company, builds off of, makes money, right? This is their top dogs. This is Michael Jordan and Scottie Pippen. This is Shaq and Kobe. Now, Dupixent and Eylea are Shaq and Kobe of Regeneron's profits. But they also have up to 32 drugs in the pipeline and 2 specific ones that are catching my eye to be the next Shaq and Kobe of the company. First is Libtayo, which is its entry into oncology, which is, to say it simply is tumor treatment. Libtayo has been approved for skin cancer called cutaneous squamous cell carcinoma. But it also just went through trials, and the Independent Data Monitoring Committee, which is pretty much just a group of experts that are, they're tasked with assessing safety, validity, scientific validity, integrity, all that shit. And they actually made a recommendation to end trials for Libtayo's cervical cancer treatment early because it was producing such good results. Patients receiving it were 31% reduced risk of death and a median 12-month survival rate compared to 8.5 months for chemo. So about 3 months higher median survival rate. So the further approval of Libtayo is a matter of time. It's in a growing market, which is oncology. More money is being put into the cancer therapeutics more than ever. And it's going after a huge market, and Regeneron has so much leverage because of their partnerships with Sanofi, or the amount of cash that they bring in, and the amount of cash that they put into research and development. So they have a bunch of leverage in a growing market with a great drug, which is showing way better results than chemo, and is going after a huge market. So this could be the future of Regeneron. Now the next drug that has actually more potential than Libtayo, and the potential to be the highest grossing drug on the market and the biggest drug in Regeneron history, is Regeneron 1979. Now this one is way more speculative than Libtayo, and I'm going to get into that in a second. But first, the only way we can really understand the magnitude of potential that Regeneron 1979 has is by first looking at Rituxan. Again, I'm not really familiar with the pronunciations of some of these drugs, but Rituxan was owned by IDEC Pharmaceutical, and the drug treated non-Hodgkin's lymphoma. And the drug brought in $85 billion in sales in the last 20 years. So massive sales numbers. And this actually helped IDEC Pharmaceuticals which ended up merging with Biogen, which you guys probably know what Biogen is. So they merged together, and then they went in 2003, and then they went on a 12,000% run during that time frame of Rituxan's dominance. Regeneron potentially has something better than Rituxan and Regeneron 1979. So first, non-Hodgkin's lymphoma (NHL) is the most common form of blood cancer in adults. Doctors diagnose roughly 70,000 new cases a year. What NHL does is it impacts the B cells, which are immune cells responsible for producing antibodies to help fight infections. And so what Rituxan did is that it actually binds the CD20 proteins, which are on the B cells, and that causes it triggers the body's T cells to attack. So this works, and it's helped millions of people and brought in billions of dollars. But there is a slight problem with their approach. Is that it kills off. So when the T cells attack, when that attack is triggered, it kills off all the mature cells while leaving the healthy immature cells to grow back. Ideally, this returns the immune system back to normal, but if all the cancerous cells don't leave the body, they will come back. So leaving those healthy immature cells to grow back increases the chance of relapse. So the patient's going to end up having to redo the treatment or get more treatment or spend more money, and their life's going to be more difficult, more pain, right? All these negative things. So Regeneron's 1979 has a different approach where they bond it. So Regeneron 1979 bonds with the CD20 protein and the T cell. And this ensures that the T cell escorts the mature B cells out of the body. So again, this mostly is for improvement in terms of relapses. And in relapsed and refractory, which are the most difficult of cases during trials, Regeneron 1979, well, it's not for all trials. Relapse and refractory is the most difficult of cases for follicular lymphoma. So for this specifically. But Regeneron 1979 had a 100% overall response rate. And in the notoriously difficult to cure large B-cell lymphoma, it received a 60% response rate. And these were only in the phase 1 trials, right? So we're early on here, and it's already showing great results. In their CR, which is their complete response, durability out to it showed durability out to 41 months in patients of its phase 2 trials. So that means that there's no more B cells 41 months out, which is the most important piece of data that an investor, Regeneron, and the FDA need. Now, the reason I say that this drug is more speculative than Libtayo is that it's still early in trials. The trial process has not been perfect, as there's been halts, there's been some incomplete trials, someone died. So there's a lot of things that always go wrong in trials, which makes it riskier and speculatory. That's why you can't invest in pharma companies that are only relying on one drug being approved. And that's why Dupixent, Eylea, and what I'll get to in the next slide are so important. But if this drug gets passed, it's going to be bigger than Rituxan that caused a 12,000% run for Biogen and brought in $85 billion in sales in 20 years. So this could be the biggest drug on the market and double Regeneron's profitability alone in the next 5 years. Next is Regeneron COVID. And this treatment kind of came out of nowhere and has taken the market by storm pretty much. It's become one of the biggest revenue streams for the company, bringing in $2.9 billion for 2021. That's the consensus, at least. So anywhere from 2.5 to 3.2, I think, is reasonable, and I've seen guidance in all those different angles. So it's an antibody cocktail, and it's proven great efficiency in dealing with new variants, and keeping you healthy while you have the virus, keeping you alive, keeping you in good shape. And there's been positive data point after positive data point in trials, and they've soared through trials. So this is a great revenue stream, which I view as a security if a drug like Regeneron 1979 fails, right? Like, we know for a fact that Libtayo is not failing and is going to continue to grow. Regeneron 1979 isn't guaranteed. A lot can go wrong. It could take a while. So we have another third enormous revenue stream in the COVID antibody cocktail, which is going to supplement the revenues for Regeneron 1979 until that becomes a reality. Now, the most important part of any analysis is understanding the financials and the valuation of a company. Regeneron has great ideas, great growth trends, great growth factors. However, if they were not a financially sound company at a low valuation, there would be no point in making this video recommending such a great stock. Now, again, this is not financial advice. I personally own the stock. A lot of people that I know own this stock. So I'm just giving you all the information. But again, I wouldn't be doing a video on anything that I didn't really think was at least worth taking a look at. And the reason that this company is really worth taking a look at is because of how solid their financials are. In the most recent quarter, they posted astounding EPS numbers of 25.8, which is massive in any industry for any company. So their profitability is through the roof, one of the most profitable companies in the world. And that EPS beat was actually that EPS of 25 actually was a 40% beat over expectations of only 17. So they were 40% more profitable than analysts even expected. And that was in big part due to Regeneron's COVID antibody cocktail. They also reported massive revenue of $5 billion, which beat expectations by 30%. So like I said, this company is bringing in cold, hard fucking cash, and they have great margins, which has led to great net income, as we can see in the EPS number. And 4 quarters ago, so year over year, EPS has went from 7 to 25, and revenue has went from 1.95 billion to 5 billion. And again, short-term assets are at 10 billion compared to a 3 billion in liabilities, and long-term is 7 billion in assets to 2 billion in liabilities, which is a great ratio to have. So financially, they are stable as can be, one of the most stable companies in the world, having great growth trends and factors that will drive up the EBITDA and the valuation. Now, Regeneron has a price-to-earnings ratio of only 11, which is dirt cheap. Their EV divided by EBITDA, which is a great valuation metric for tech growth companies, is only at 9, which is practically record lows. Regeneron was at around 450 in price a few months ago, and it's shot up to 660. So we've had a good run, and obviously their EBITDA was at a low at the 450 stage, but their EBITDA really didn't really correlate with the price because their earnings have been so massive that their stock price should be way higher, implying undervalued. But their EV to EBITDA, which is enterprise value divided by earnings before interest, tax, appreciation, it's pretty much the true earnings in a sense, is at 9, record lows. It assumes no growth in the next 3 years. So this is how a great way to forecast is you take a conservative estimate. This is the most conservative estimate I could find from analysts for 9.3 billion in sales by the end of next year. So if that happened, their EV to EBITDA would go to 17, which would imply 114% growth. Now, I personally think that the revenue will be more in the 10 to 11 billion range, with the EBITDA closer to ratio of closer to 20, which would probably imply 150-ish% upside from here. So, look, another point. So Regeneron has seen year-over-year EPS growth of 250% and 164% year-over-year growth in revenue, but their stock is only up 11% in that time frame, and was down until their recent run-up. So the company's share price and valuation is not growing even close to how fast the company is, which is an implication of undervalued. And I think the metrics speak for themselves. It's a very undervalued company, great financials, great trends. Regeneron is a safe and perfect company to invest in. This is not financial advice, but I think Regeneron requires you to research it. Thank you. Have a good day, fellas.